What type of organism is HPV? HPV is a STI for sexually transmitted infection. It causes genital warts, and in some cases, if the strain is a high-risk one, it'll cause cervical, anal, penile, and even oral cancer. HPV is connected to about 40 sexually transmitted wart strains. HPV is found in several families of DNA-containing viruses. Those are as follows: Adenoviridae, Herpesviridae, Papoviridae, Poxviridae, and Hypadnaviridae. HPV only infects humans by inserting itself into mucosal membranes, such as in the mouth, throat, genital, and even anal areas. The harm HPV does to humans is only when a cancerous strain is contracted. The risks of contracting HPV for both men and women are: they need to limit their partners and make sure those partners have low amounts of partners as well. Also, being younger than 25 can be a big problem due to irresponsible decisions. Also, starting at a young age, such as 16, is another big risk. And lastly, men who are not circumcised have the high chance of carrying infections. The mode of transmission can be through kissing, oral, anal, and vaginal intercourse. Any mucosal membrane can be infected by skin-to-skin contact. The genital warts can start out as a latent infection, then become a chronic lifelong disease.
Most people who have HPV don't know they have actually contracted it. 50% of sexually active people have HPV, whether it's a low-risk or high-risk strain. So half of you have some sort of HPV, although you may never know because HPV almost never shows any signs. If HPV is contracted, genital warts may begin to appear a few weeks to a few months after the initial contact. Depending upon contact, you may be susceptible to oral and also anal warts. If low-risk HPV is contracted, it may flush out of the person's system within 2 years. Signs can be detected via pap smear. For those who may not know, a pap smear is done to test scraped cells from the opening of the cervix for abnormal or potentially cancerous cells. PAPs are a method of diagnosis for cervical cancer for women. As for men, there are currently no methods for diagnosis. According to the CDC, as of 2008, the prevalence in the United States estimated to be about 79 million. From that same year, the new estimated cases were 14 million nationwide. Treatments for genital warts consist of topical creams and gels. For example, Aldara, which helps speed up the immune response by producing interferon, and Podophylax, which slows down the growth of warts. Surgical removal was also an option, although it may not be recommended due to the fact that warts can be reoccurring. Fortunately, there are vaccines available for both males and females between the ages of 11 and 26. As for women, there are 2 vaccines, one for cervical cancer, which is called Cervarix, and the other for genital warts, which is called Gardasil. For men, only Gardasil is available. Since men do not have a cervix, there is no need for a vaccine for cervical cancer. These vaccines work against common types of HPV and are given in 3 separate doses over a period of 6 months. There is a possibility that women can acquire a nosocomial infection due to the contaminated or non-sterile instruments in hospitals or any other clinical environments. In rare cases, children are susceptible to RRP, which stands for recurrent respiratory papillomatosis, or in other words, known as warts in the throat.